This is our ClearRx MicroPeel certification webinar. And what I really want to go through with this is to not only talk to you about what makes the ClarityRx MicroPeel different and why we do it differently than maybe you've done in the past, but really to keep you in a zone where the client's getting the best results in the safest way. It's critical that we walk through the protocol as well. On this today's certification webinar, everyone will receive an email back from us that includes two important documents. One is going to be an exam in which you're going to take and send back to us. The other is going to be a professional consent form that says that you will follow the protocol that we put in place. That's really for the safety of your client. It's for the liability of your spa owner, your own liability, and of course, ClarityRx liability. So we just want to make sure that we're doing this properly. The other thing is that it's important for the consistency of the blend. And if you work for a hand and so it's really considered very important that the consistency where we deliver the service stays consistent amongst the chain as well. So, things that make our MicroPeel different. One is that we make sure that all clients or all estheticians, that are joining today have met the prerequisites. If you aren't, we cannot certify you. Before we go any further, I just want to make sure that everyone, including owners and others, if you are a licensed esthetician, you have to go through all of our product knowledge and all of our peels, and also be performing our peels for a minimum of 3 months before or behind the chair without any incident. So once you've met these prerequisites, we're to then certify you in the MicroPeel for clarity. We do it at a level that we make it mandated so that, again, your clients have a good experience with this protocol and also that you're getting some consistency in the result. There's a lot of variables to the way these protocols could be delivered, which could offset the positive experience that we're looking for you to have. So making sure you've met all the prerequisites to go forward. If you haven't and you need to join those, you can also view those ARC webinars on our website. If you need to join it live, our next one will be hopefully in December, and you can join us live for that. So for those that have met the prerequisites, this webinar is going to take about maybe 20 minutes. It's pretty simple to understand. I will follow through by providing you also an email attachment of the protocol, of the consent form for the clients, and also some more information about the ClarityRx MicroPeel. Forward, we keep the waivers on file. For those of you that work for Head and Stone, it's mandated that the professional waiver is to be filled out and kept in the files of the owners and managers. Once your exam is also provided back with us, and we provide that to corporate Head and Stone. If you work for Head and Stone, they then will push out the codes and the provider name so that you can start taking appointments for MicroPeel. All that takes place within 3 to 5 days of the webinar, so we move it along pretty quickly on our end. So let's go ahead and get started. The first thing is the professional consent. It looks something like this. It basically claims that you've been performing the peels. It says 6 months, but we're lenient on this. At least 3 months without any complications should be sufficient in most cases. Also, it says that you will review and understand the proper protocol and that you'll provide or follow the protocol provided by us. And this is the way that we can stand behind making sure that the end result of these MicroPeels are what we know we can get. So what is a MicroPeel? It's really considered for most of us the next level up than just a standalone microdermabrasion or a standalone peel, whether they're standalone protocols or add-ons or enhancements to a facial. MicroPeel is really the next level. So if your clients are reaching a plateau, and sometimes we see that they do, as we know that the skin can become acclimated to our services, no longer respond as favorably, this would be a great time to introduce the MicroPeel. So in my opinion, clients really should have gone through either a series of our peels or cell stations with an upgrade to a peel before they reach the micropeel level. This just ensures that they can tolerate it well. It ensures that they won't have any significant downtime, and they know what to expect with the individual modalities, and that the skin, more importantly, becomes conditioned for the more progressive therapy. So I assume that most of us know that we want to build up to this point. This is all a really good service to then maintain your client base, because it is a much higher level of service, and it prevents our clients from thinking that they need to go somewhere else to get to kind of the next level. What is the experience with micropeels? Obviously very similar to what we experienced with the standalone peels and the standalone microderm, but maybe a little bit more progressive. If your clients are looking for what to really expect with the micropeel, they can expect to see the following. A series of peels and or 1 to 2 micropeels, we see a huge transformation or improvement in the texture of the skin. Why? Because we're really using two modalities here that are not only ensuring us that we're removing almost 100% of the stratum corneum, if not the majority of the dead epidermal layers, but also then transforming the skin from the inside out via the micromassage from the vacuum of the microderm and the stimulation that's occurring within the skin. And so we're really creating changes from the outside in and the inside out when we use both of these modalities together. We know that when we trigger the skin's ability to be stimulated, also stimulating all those other mechanisms within the tissue. So we're seeing a lot more water and oil production, resulting in a lot healthier appearance to the skin, a very finish to the skin when we finish with this micropeel service. And again, along with that comes all the other goodies that we know. Increased oxygen flow to the skin results in better blood flow, and also helps with the healing process. So we're seeing a quicker reduction of these real great fine crinkle lines and wrinkles in the skin. Again, a lot of that has to do with removal of that dead cell layer that's kind of hanging around, but also because we're really thin fibroblast productions will help us grow collagen, which is really plumping and firming and really diminishing the appearance of those lines from the inside out as the outside in. Finish of large pores, again, those clients that are serious about doing the appearance of these larger pores just by keeping the skin very clean and exfoliated to the depths of which the micropeel can do, especially the ongoing vacuum of the microderm can help diminish the appearance of large pores. Just through the production of collagen as well, we can help to diminish the pore openings as it kind of swells the circumference around the pore. Again, overall, it continues to brighten any skin discoloration and overall brightening as is to be expected with just one micropeel. If we're honing in on dark spots or pigmented lesions in the skin, we will take several, but the overall skin brightening really does occur with just one. We see a lot of tightening and firming with micropeel. So it's kind of everything you would imagine that the dermabrasion does on its own, or the peels do on its own. They take a series of those single modalities where the micropeel, we can see it a lot less frequency. So my micropeels, honestly, this is the next level up. There's a lot of well-documented evidence that the combination of these two modalities, the skin chemically as well as mechanically, really helps to satisfy really from the inside out and the outside in. So again, it's just the highest level treatment for those that are really needing more. If you're really looking to turn the corner in the corrective work, such as with acne and pigmentation, laxity in the skin, it may require multiple micropeels, but again, we're moving at much more progressive level, just the standalone. I'll just slide in here because I think it's important to look at what happens with the effects of one micropeel. This is an addition of the peel itself and then 2 passes of microdermabrasion. And looking at right here is really, is really the stratum corneum layer. I'm going to go back to this. The buildup on the surface of the skin here should be almost eradicated 100% with these two modalities. With the peel alone, after one peel, This is what we see. So the solution itself is really good at loosening the bond or the keratin bonds that are holding the skin cells on the surface and allow for actually to become a prep for the microdermabrasion. With one pass of microdermabrasion, we're alleviating most of the dermis, and you can see with two passes, not only do we have a much smoother surface to the skin, we're also able to see these dark spots that are producing a little bit of fibroblast production, which is in turn going to be able to help us grow collagen. So cumulatively, we know that we're really developing something great underneath the skin. Probably within one service, we can expect to see softening of the texture, improvement of the condition of the skin, and overall healthier appearance of the skin. And again, we're removing 90% of that dead keratinized skin on the surface. So just to kind of give you a physiological look at really what happens with one service of MicroPeels. When asked who can get MicroPeels, in my opinion, it's always similar to, again, the other single modalities, is that your client's skin has any evidence of redness, irritation, erythema, sensitivity levels are heightened, anything that looks and feels as if it's warm or red, then they're probably not good candidates for the MicroPeel. They may not be good candidates for a standalone micro or a standalone peel as well. So it's very similar, and the indications and the contraindications that we're used to doing. Because this is a little bit more progressive, I do try to stay away from the skin types that are a little bit more sensitive or thinner. Actually, like a subtype 2 severe rosacea client. Also, color acne or even a cystic acne is very difficult because, again, it's hard to treat over something that already has some soreness or risk to it. So I think that everybody can benefit. We've got some variables outside of these sensitive skin types that we can work with to turn it up or turn it down a notch, if you will, and that's how long we leave the peel solution on, and then also how many passes of the microderm and at what levels of the vacuum. So clearly within the two modalities, there are many different ways that we can create the variables to adjust the progressiveness of the MicroPeel service and customizing to the client's actual skin type. And I would take that into consideration too before starting with the service. This is extremely stimulating for the skin, so clearly, again, any skin type that seems or looks or acts or feels as if though it's overstimulated already, it may not be a good choice. On the other hand, it's really great for your more sluggish, congested, maturing client skin type that looks like it can use a little stimulation. So I do think that there's actual progression that we should go through when clients are looking for more. And I think that the natural progression is that the clients come in for our facials first, and they to some of the more customized, exceptional facials. Then we start adding different modalities of micro or peels to those. And then we look at maybe series of the standalone peels or micros, and then the highest level or the top level then within the scope of our practice becomes the MicroPeel. So in essence, I encourage my own clients in my practice that they have to kind of get to that level and earn that level because it'll eliminate a lot of negative experience, but also the skin becomes more conditioned to make it a better result. And then also it makes them work towards the higher levels in a way that makes a lot of sense for everybody. So that's typically how it's done. Now, some of the things that we should look for, very similarly to our standalone peels, is the only conditions that are really contraindicated to this is clearly are those who are pregnant. We don't do any peel solutions or any low acidic peel or acidic products on anyone who's pregnant or throughout the breastfeeding process. So that's the first and foremost. MicroPeels are contraindicated to our clients who are currently pregnant or breastfeeding. The other conditions we should avoid, especially with the peel solution, but combined particularly with micro, again, anybody with an active herpes lesion or condition, and if they do have to get breakouts with the herpes, then they really should be proactively taking their meds before and after the services position. It can, because of a lot of inflammation, even create kind of a breakout for those that are somewhat dormant with it. So just to be very cautious and throughout the consultation process, making sure we're asking a lot of these questions. And they don't want to see it spread here or have it onset. So it's just a conversation in private that we have to have. It's uncomfortable to perform this over, again, a very pustular acne. In opinion, we should get the skin in the best shape possible. Means that we should be eliminating a lot of the activity within the pores, having them come in, again, for a couple condition stages with extraction. We extract the skin of the micropeel. So, again, don't want any pustular activity going on. A, it makes it uncomfortable. B, you really don't want to be performing the mechanical or the chemical creation going on over those kind of pain lesions. So again, if it's a subtype 1, a penile facial condition, or if it's just in certain areas, it can be worked around, but in most cases, it's contraindicated. The open sores or lesions or any undiagnosed or suspicious-looking lesions, if there's anything that looks odd, they should be consulting their physician first. We just don't aggravate any condition that's currently there. Same thing with any other skin disorders or diseases that are outside of our scope of practice. If they have dermatitis, psoriasis, eczema, those should all be advised by a physician before we go forward. Again, we can't diagnose, so it's hard for us to tell exactly sometimes what's going on. Even if we know what's going on, we shouldn't be sharing that or diagnosing. So I just ask some questions if there's what's going on with their skin, if they've seen a dermatologist for it, and it's a good advice to just to make sure that their doctors are aware that they're getting progressive procedures in a spa environment. That are on Accutane or have been recently on Accutane, in my opinion, need to be off Accutane for 1 year. They're candidates for the MicroPeel. Accutane suppresses all the sebaceous gland activity. They have no oil production, very, very dehydrated as a result. They become very water dry. And so what happens is they get their increased sensitivity levels, and they're very sensitive to this process. So make sure those clients are conditioning their skin well, and they've been off Accutane for up to 12 months. It says 6 to 12. That's because there's leniency. If the skin looks somewhat normal and you've done patch tests and they look like you're going to be okay, then 6 months just may be okay for a selected few. In experience, it takes about a year before they're really okay to go forward. The MicroPeel protocol is very different than maybe what you've done in MicroPeels in the past, and there is a madness to our method here. Because we're working with a low pH, non-neutralized peel solution, there's no way that we apply the peel solution after microdermabrasion. Microdermabrasion isn't an exact removal of the tissue, so what happens typically in a low pH environment is that peel solution will migrate and grab in the areas that we've maybe microdermed a little bit more progressively or unevenly, and so we'll avoid it for that reason. The is that it just really is uncomfortable for the client to be filling with the micro first. The other difference that you're going to see is that we only allow our MicroPeel protocol to be done or performed with our salicylic acid, and there's reasons for that. One is that salicylic acid provides a very great antimicrobial environment. It also suppresses inflammation and almost hardens the skin, making a great canvas for us to perform a very even, nice microdermabrasion. The other part is that if you apply the peel solution after microdermabrasion, it can get a little streaky, but like I said, it's a little painful. If you're using any of the other peel solutions, like lactic or lactic or glycolic before the microdermabrasion, the skin becomes very softened. It's spongy in texture, and it's easy to tear or to get too progressive with the micro wand, even at very similar vacuum settings that you would normally do that. The protocol is different. The two things to remember is that it's only salicylic acid, which means if they have any known allergies or can't tolerate the salicylic, they're just not a good candidate for MicroPeel. That outweighs the advantages allowing you guys to do it with the alpha hydroxy acids because of the contraindications that we've seen. Second is always peel solution first, micro second. Part of the reasons why, again, is because we're working with a low pH peel solution here. And so that is a big difference in the protocols according to most other product lines. So, recap, and we will also be getting this in the email from me again, is I just want to make sure prior to getting started that we've crossed all our T's and our I's, making sure that the clients are signing all the consent forms. There is a MicroPeel consent, which is really kind of a combination of both the microderm and the peel together, but they do have to fill out that separate MicroPeel consent. MicroPeel consent is good for up to 6 months, as long as we've seen the client on a regular basis, which usually is monthly or more. If it's been 6 months or more and we haven't treated that client for over 6 months, then we're required to fill out that consent form again. Once you through all of that, the consent form is signed, we're going through a consultation process. It is a good idea to do a patch test to get a peel solution on either the nose where the skin is the most sensitive, to make sure that particularly on that day they can handle that peel solution. There's a lot of variables to what happens day to day with the skin. So also that we talk to them about how they currently care for their skin that morning, making sure to scrub or use a clear sonic brush or take a recent hot shower or exercise very recently where the skin is very warm. All of those have an impact on the end result of the MicroPeel. Basically, your skin should feel cool to touch. It should be void of any redness or erythema. It should be pretty normal and in pretty good shape before you begin. So a patch test will just indicate if there's any unknown reasons to not go forward that day. You're going to want to then apply, obviously, the cleanser, the cleanse daily, very mild cleanser, and pre-cleanse and removing very thoroughly with just nice tepid water and static wipes. Please do not use towels or actually sponges. I'm seeing more problems as a result of that where we're just wiping and wiping and wiping with rough sponges or towels. Please, pores are only called out in the aesthetic protocol. There is a difference. We can aggravate the skin in a much higher level if we're using sponges and towels. Right before we begin, I like to spray the skin with a couple of spritzes of the Take Your Vitamin spray, kind of rehydrate the skin a little bit, give it some rinse, and then pat dry with just a tube or let air dry, or you can fan it dry. We have to make sure that the skin is then completely dry before we apply salicylic acid. If the skin is moist, it will grab the acid in the moist areas and cause an uneven application. Salicylic acid goes on with the brush very evenly, very quickly, one layer, just like we do our peels. We do on for up to 3 minutes. It doesn't have to stay the entire 3 minutes. Making sure you clean with your clients throughout the entire 3 minutes. Once the minutes are up, you're going to take your vitamin spray and spray a liberal amount all over. Watch that you're not spraying to get pockets of spray in the eye area so it draws in the peel solutions. But just a couple spritzes, and then rinsing cool with your 4x4s only again. Then skin completely dry to touch. So your client should be feeling of a 0 to 1 once all of this is off. They shouldn't be experiencing any prolonged stinging as a result of the peel. And if there is any, just keep fanning them until they say they're not experiencing any, or between 0 and 1 is average. Then they're going to be in your microdermabrasion. Do up to 2 passes. Again, holding the skin very taut and prevent dragging of the skin, making it as comfortable as possible. And once you're finished with the microdermabrasion, twice, possibly around the face, I want to just remove again any debris around the face with your cool water and 4x4s, no towels again. The way that we finish this process off, again, it's just a 30-minute standalone microderm peel elimination here. It's not as an upgrade at all. It's booked out as a 30-minute standalone service. To finish this service off, once you remove the debris from the microdermabrasion and the skin is pretty warm and dry, make sure you apply a thin layer on demand. This procedure will help to take down any erythema or discomfort, and make sure you're using the fan and dry it into the skin. The fan elevates the coolness and actually take down the temperature of the skin, so the skin will feel cool. It almost feels like not without the hot. It gets very cool on the skin. In severe dry cases or patches of dry, you can apply the Nourish Your Skin. It's 100% squalene oil. I prefer this over the creams. And Calming in the Morning has a little retinol palmitate, which is your vitamin A, and it could cause some stinging. The other thing is the Nourish Your Skin is very mild, and it actually is very benign on the skin. It doesn't act at all up on the skin. So don't apply too much because the skin to be able to not be occluded. You want all the heat to escape, and so just a tiny little bit of Nourish Your Skin if needed, especially on your more mature oil dry client. Obviously, allow all that to dry in really well, and then apply your Skin Defense SPF on top by just kind of patting it in. We know micropeels have a cumulative effect. The more that we do, the better the results. So they feel a difference with one. I love to have multiple sessions of these for some of the clients that are in it. In my opinion, it can be done as frequently as every 2 weeks for some clients, as long as they don't have any residual redness, peeling, or irritation from the 2 weeks prior. The sweet spot seems to be once a month for most clients. So it just depends on the client's skin type and the state of skin that you're working in, but more than every 2 weeks, preferably once every 30 days or so. Clients definitely may or not experience some of the following. I think it's critical to tell your clients that sometimes this is even as variable for the same client in just different treatment times, is that sometimes they can experience some redness, prolonged moderate flaking, maybe up to 3 to 5 days where they're seeing some dryness and flaking and feeling warm to touch. And then sometimes that same client may not see any of that. There are several different reasons why. But it's a good idea to always preface this by letting clients know they should be experiencing or may experience some redness, something or sloughing, some hardening of the skin a little bit before it starts to flake. Same thing applies with the post-procedure instruction sheets with the peel microderm separately. Is again, exercising within 24 hours. They shouldn't be peeling or picking away the loose skin. To go in jacuzzis or saunas, all of the same things would apply here, and maybe a little bit longer out depending on the skin type. But it's common for them to see or feel some of these experiences following the service. Very cautious and making sure they understand the importance of their sunblock. We are removing that incomplete resistive layer of the skin that protects the skin a lot. So when it's pretty vulnerable, it's more vulnerable to the UV damage from sun. So make sure your clients are very diligent with their sunblock. This is just an example. We'll see an example of the actual form that is made available in the spa. These are, again, the creation of both your peel and your microderm consent form. Very similar. I'm going to open it up to any questions that you guys might have. And if there aren't any, we will be receiving an email directly from us in the education department. We'll have the following attachments. It will have the full protocol for you to review again. It will have more information about consumer information about what the MicroPeel is and how it's performed and who's a good candidate for it, how often we recommend it. And then you'll also be receiving the professional waiver. The professional waiver is something I need you to fill out and send out back in to us with your exam, which will also be attached. That exam is just an overview of what we discussed today. Do you have to fill it out the best that you can. If you have any questions, please feel free to email us at education@clinicalskincare.com to have you go ahead and pass that exam so you can get this done in one shot. We also, in addition to all of that, if we receive all that back in, then notify corporate Hand and Stone if you're an employee at Hand and Stone of your exam being in-house, and then they will send out the codes and the provider's name. You should go within 3 to 5 days of that. The quicker you get all that back to us, the quicker we process it on our end, and you'll be good to go. You'll also be receiving a certificate of completion from us at Clarity. I recommend that you provide that to your owner or spa manager and a copy of it yourself. and that the owners and managers keep a copy of that in their HR file. If there are any other questions that you have after today's webinar, please don't hesitate to contact me directly. I'll be happy to help as much as I can. Let's go through questions here just so we can address it to the group. Sometimes that's a bit more, let's see. A lot of questions asked about pricing. I really don't address the pricing. That's something you're going to have to address with your owner and manager. But it's a 30-minute protocol, and it's averaging, I think, around $80 in most markets. But go ahead and ask your owner and manager for your pricing in your region. Do we on the mend off the skin and then apply the sunblock? Now you want to dry in that on the mend. It's a beautiful way to hydrate and soothe, and that's something you want to keep in the skin. Great question. Christina Smith, if a client is doing micropeels every month, how many would you recommend before going on to the less aggressive treatment? Really reach your goals. I mean, in opinion, it can be done until we've reached the goals, and then maybe maintenance looks like a little bit less often, or aggressive treatments. So depending on determining and managing your client's expectations are pretty important here. But I've done as many as up to 4 to 6, run for 4 to 6 consecutive months on clients with some pretty phenomenal results. I hope to help you out. I think that is all for the questions. We had a very large group here today, which means that our administration part about getting this all done will work as quickly as you can get all that information back to us. You can expect to receive an email from us, within 24 hours today. Again, as soon as you can get that back to us, we'll get you processes. In the meantime, feel free to reach out anytime. I want to thank you guys for your time. I know it's important, and we hope that you have a great afternoon.